Welcome to this next session, which is a discussion session about focused ultrasound and radiotherapy. There are two panelists, Doctors Padilla and Liu. Dr. Padilla has given the recorded session on this, and I'll ask him to present a quick summary of that, and then we can open it up for discussion. Dr. Padilla?
Thank you for inviting me to this panel. So I think what I try to convey, the message I try to convey in the short presentation is that the most obvious or used focused ultrasound modality to radio-sensitized tumors so far has been hyperthermia, with several, at least phase 1 clinical trial for different indications and proof of efficacy of radio-sensitization in different indications, especially, for example, in prostate. The application of that to the brain is to be seen, and I think there are especially some technological limitations to the transfer of technology that we can discuss. And besides, so I think the most exciting and recent work in terms of radio-sensitization, of course, are coming from your lab, Dr. Czarnota, in terms of using microbubble disruption, or let's say antivascular therapy or macrovascular disruption to radio-sensitize tumors. So again, to be seen how this can be translated in a brain and GBM settings. And I think I will let Dr. Liu speak for it, but I think the other aspect that is very exciting is the potentiation with BBB opening type of treatments with increased oxygenation, for example, or potentiation of an immune response that can also be combined with radiotherapy. Sorry. And the last point I mentioned, I think, in the presentation was, of course, the use of focused ultrasound for delivery of maybe novel agents like PARP1 inhibitor or other type of radiosensitizer. That could be another avenue.
Sure. Dr. Liu, would you like to comment on what you think the future is for radiation enhancement and sensitization?
Yes. First of all, thank for the foundation's invitation, and thank you for letting me in. And Dr. Padilla also recorded a very nice video, and I do have some comments because everybody knows the radiotherapy is a major treatment for brain tumors. But however, brain tumors often respond poorly to radiation therapy due to hypoxia-related radiation resistance. So tumor hypoxia is a common feature that cause some heterogeneous vascular networks, and sometimes the hypoxia effect caused by this heterogeneous vascular network. So we believe it is associated with the resistance of the radiotherapy and cause the poor clinical outcome. But right now, the focused ultrasound to cause the blood-brain barrier to have the chance to change this microvascular activity and tumor reperfusion. We do see some evidence, and some other groups also conduct very nice preclinical studies showing that the ultrasound combined the microbubble indeed have the capability to change the microvascular activity. So the answer, I think, is yes. The microbubble combined the focused ultrasound to open the blood-brain barrier could be served as a radiosensitizer to help the radiation therapy.
So do either of you think that if you either use hyperthermia or focused ultrasound with bubbles, is it normalization of the vasculature that's occurring, or is it reperfusion with oxygen, or both? I mean, there's differing studies in the literature showing either more hypoxia or anoxia being caused by vascular disruption, and there's other work showing that perhaps that happens, but it's followed with normalization of the vascular distribution. I don't know if you have any thoughts on that.
Yes, for some literature review, and I do saw some groups, they are doing the experiments, not particularly in brain tumors, but other xenograft tumors, but they see the vascular change. But some studies, they show the vascular reduce, but some cause some reperfusion. So it really depends on the tumor model, but the outcome, surprisingly, they do have the suppression effect. And another effect I also want to highlight is we do see some reoxygenation effect after using the focused ultrasound combined with the microbubble. So that might be a major cause to help to improve the hypoxia situations in the tumor condition.
Dr. Padilla, I think we have 1 minute left, so the parting comments are yours. Any thoughts on that in terms of mechanism?
I think it's interesting to have these two options with potentially very two different mechanisms. And what you have shown, for example, the involving the ceramide pathway and the apoptosis of endothelial cells are very different from the mechanism that can related to hyperthermia with the DNA damage repair imperfection following hyperthermia. So I think we should play on both and examine both in GBM settings. Okay.
Thank you for both, and I think that concludes the session. We're going to have a short break now until the next panel convenes. So thank you again for your thoughts.
Thank you very much
today.